Health is the department with the biggest budget and the largest overspend, and there was a lot to say about it. Gemma Arias-Vasquez started with the numbers and of accusations of massaging figures.
So the figure which is given to the GHA, ERS and the care agency by government is not 207 million, as stated by the Honourable Member opposite, it's £211 million. I would not ordinarily have the temerity, being a mere lawyer, to argue with an accountant on numbers, but given that I made the same error and I actually went and double-checked and I saw the figures were different when I added them up, I asked the Financial Secretary late at night, so sorry about that, Financial Secretary, and he explained why these two figures didn't quite add up. I thought it was important that we at least depart from the correct premise.
The big announcement in Health Today, however, was the relocation of the mental health facility in Coney Island to the site of the former Gibraltar Chronicle.
We will be refurbishing the old Gibraltar Chronicle printing press building to accommodate the new community mental health facility. However, this will not purely be a lift and shift of the current services. We'll be using the opportunity of the relocation to deliver a whole new model of care, integrating physical and mental health, and which will provide support for employment, accommodation, rehabilitation, therapies, and financial advice. It is intended to be a net to ensure that people find the support they need in the community, so that matters do not escalate till they then require hospitalisation, and that they do not fall through the net. And all of this, Madam Speaker, is largely to be done through the donations of a benefactor, which I think is important for the Honourable Mr Clinton to hear. This benefactor will be providing the lion's share of the funding.
Staying with mental health, the Minister said the first ever registered mental health nurse training will begin in September. 2 frontline ambulance vehicles and 1 high-dependency vehicle should be arriving after the summer. Gemma Arias-Vasquez has plans for an AI digital strategy in mind to future-proof the service. Quarterly reports are to be delivered to the GHA board by the clinical governance lead to promote accountability and transparency. Gemma Arias-Vasquez stressed that the GHA will remain completely and entirely clinically independent. On the COVID fund, a referral panel made up of healthcare professionals and lay people will look into consultation responses and recommend to the Minister how the £2.7 million should be spent.